Hi, and welcome to the show. Subscribe at kevinmd.com/podcast. Today, we welcome Ronke Lawal. She's a healthcare executive. Today's Kevin MD article is Digital Mental Health's $20 billion blind spot. Ronke, welcome to the show.
Thank you, Dr. Fu.
All right, let's start by briefly sharing your story, then we'll talk about your Kevin MD article.
Okay, so hi everyone, hi our audience. My name is Ronke Lawal and I'm the founder of Wolf. So Wolf is currently being built within the intersection of neuroscience and artificial intelligence. And it became something I had to pursue due to my concern for the global mental health crisis. So currently about 1 billion people globally are living with a mental health disorder, and two-thirds of them do not have access to mental health care. It's either too expensive, there aren't enough professionals, or stigma simply holds them back. In certain regions, especially developing countries, people rely heavily on traditional and religious healing practices, so they never consider seeking mental health care. So Wolf is meant to provide adequate, accessible, and affordable mental health care for them globally.
All right, so your Kevin MD article is Digital Mental Health's $20 billion blind spot. For those who didn't get a chance to read your article, tell us what this one is about.
Yeah, so my article is about a $20 billion market opportunity that's currently being ignored by players in the United States digital mental health market. So currently the market is worth $8 billion, which seems quite large, but it could be bigger if they considered 40% of the United States population that's currently being ignored. And these are people within certain communities, such as African American, Asian American, and also the Hispanic community. So these people actually face a lot of cultural barriers when it comes to seeking mental health care. And my article addresses that closing this gap by providing inclusive healthcare isn't just a moral goal, but it's also the single biggest market opportunity, single biggest opportunity for the market.
All right. You mentioned some cultural barriers to mental health care in these demographics. So talk more about that. Give us some examples of what that may look like.
Okay, so generally, the cultural barriers occurs traditionally and also in digital mental health space. So traditionally, let me talk about that. This is what that looks like. In traditional space currently, African Americans who are suffering from affective disorders such as depression, bipolar disorder, dysthymia, are often being misdiagnosed as having schizophrenia,
Mm.
while African Americans and also Hispanics are less likely to receive guideline recommended care within the healthcare system in comparison to their white counterparts. And this is really unfair and usually stems from lack of representation quite often, and also sometimes just lack of care. And for the digital mental health care space, the problem is usually more of a product failure, whereby the product that's currently in the market isn't so compatible for users within the market.
So you're saying that a lot of the training models that these digital mental health models are used, they don't necessarily include a lot of these other cultural demographics.
Yes, and there's a lot of reason behind that. So for these models, the data they actually collect to actually build models are from traditional mental health care. And what does that mean now? We already addressed how they are underrepresented. There's an underrepresentation when it comes to professionals.
Yeah.
And yet, so within this, we also have situations whereby even Black children and even Hispanic children, they are suffering from depression, are often being misdiagnosed as having conduct disorder. So with all these data that currently exist are accumulated and now used to train models. And something that artificial intelligence is really good at is in magnifying things. It expands it. So we are scaling the same problem that actually exists within traditional mental health care.
And in your article, you talk about this chatbot example, Tessa, right? So
Yeah.
tell us about what happened in that particular instance.
Um, so for Tessa, it was them creating an application that was meant to help people that are suffering from eating disorder, but it was very uncompatible, and it became something that was affecting patients negatively, users, and it had to be taken down. And this is a problem that also occurs even with usual mental health care app, whereby a physician could refer a patient to use an application, and the patient could actually log in. And let's assume this patient is a Spanish speaking patient, and
Hmm.
then they log into the application and they realize that there is something missing. And what's this is the fact that the application might be offering them an intervention that is more individualistic. Meanwhile, this patient comes from a background whereby culture and family is very valid, a collectivist culture. So for the patient, this is a product failure. Meanwhile, on the side of physicians who might be unaware, it seems like non-compliance to them because they could see this as a patient that is willing or unwilling to change. So it's a kind of situation that affects everybody in different ways.
Hmm. Now, what are the reasons why a lot of these AI models they don't include a lot of culturally diverse demographics? Is it simply due to cost? Is it difficult to incorporate some of these cultural nuances?
So I would say a lot of it stems from underrepresentation. There are about 37,000 mental health professionals, and only 10% are people of color. And we have about 300 million population, 300 million people within the United States. Now, 40% of these people are represented by just 10%. And it's even more nuanced than that because you have to consider we have like biracial individuals,
Yeah.
also people within interracial marriages and all of that. So they don't even have enough people to cater to them. So when artificial intelligence models are being trained, everybody needs data. And the data you're going to get will most likely be something that isn't really beneficial for a certain demographic. It's an homogeneous user-based data. It's a data that only benefits a certain, like the majority. So when you use it, you are simply amplifying bias, and it really wouldn't be able to build something very intelligent. In addition to that, another problem is that when people are building these applications, quite often they really do not see diversity or cultural competence as something that should be built within the system.
Hmm.
They never consider it as something that should be part of a DNA or a very, very critical logical part of the system, right? They simply see it as something they need to add. And for diversity and inclusion, you can't retrofit those things. You can't create an app with a particular kind of data and expect several people across the world to use it or for it to actually benefit several people across the world. That's something that would hardly ever work. Yeah, so that's part of the problems that people actually have. And I think a lot of the time they just never consider what the issue could actually be or what bottlenecks they could experience along the way.
So you're saying it's not a problem with the app themselves, but it's just a fact that we don't have a lot of cultural representation when it comes to mental health care, and a lot of
Yes,
that data that apps draw from comes from that, right?
yes, you're right.
So where does that leave patients with culturally diverse demographics? Do they tell us about some of the effects that it has on them? Do they simply just not receive the culturally appropriate mental health care?
Yeah, so mental health care is really critical, and untreated mental health conditions would lead to severe consequences. Studies continue to show how untreated mental health issues often increase the risk of disabilities, heart diseases, and also nervous system dysregulation and other forms of chronic illnesses. So, this would definitely place a financial burden on individuals and the society as a whole. And then it increases poverty levels and reliance on government support. And we need to realize that once there's an increase in poverty levels, it means that there's going to be an healthcare system problem. So the people within this demographic, or yes, this demographic we're speaking about right now, who don't have access to good mental health care, there are people who don't get help until they're in crisis, which would lead to higher emergency department utilization. That means they would always show up at the emergency room, and it's always when they dial 988, 911, or when a primary caregiver tells them, show up at the emergency room right now. That's what happens. And this costs a lot of money and increases readmission rates. And hospitals who operate under value-based care models would lose money on readmissions every time. It's a vicious cycle.
In your article, you call for cultural intelligence to be embedded into the technology. What exactly do you mean by that, and what would that look like?
Yeah. So for cultural intelligence, it would be something like that. It's an adaptive therapeutic framework, right? So whereby currently we have a one size fits all application.
Yeah.
That shouldn't be what should be the reality. Many patients usually narrate that they're having some affective disorder or some issues at home and things like that. The app should be able to relate to people across various diverse backgrounds. Person A might be someone you could actually tell, oh, you can meditate or do some grounding exercises whereby you count certain numbers. While person B, you might actually need to ask them about their family, ask them how they interact at home. How do you solve problems at home? What would you like to see? Or would you like for a family member to join you in these interactions that we're having, that kind of thing. So it makes them feel like, okay, you understand their cultural framework, and it makes them feel considered and respected. So that's part of it. For us at Wolf, one of the things that we have considered is to actually create a multi-ontology system that maps culturally specific expressions to therapeutic concepts and adjusts interpretations on based on cultural markers. Like it adjusts your interpretation no matter what a person says. You know how sometimes when someone says it's fine,
Mm-hmm.
it varies across different backgrounds. The interpretation varies. So adjusting interpretation based on cultural markers is very key. And we also try to incorporate cultural healing frameworks with evidence-based therapy. So all of this shows that cultural competency is something that, out with the importance, it's something that can actually help everybody and not just a particular group. It benefits everybody across the globe, across the country.
We're talking to Ronke Lawal. She's a healthcare executive. Today's Kevin MD article is Digital Mental Health's $20 billion blind spot. Ronke, let's end with some take-home messages that you want to leave with the Kevin MD audience.
Yeah, so my take home message would be that cultural competence is not a feature, it is the foundation. And we must stop asking how to add diversity and start asking if a tool was designed for diversity from day one. You know, the consideration must be intentional and not arbitrary. And for clinicians, I think that it is very appropriate for them to hold their vendors accountable and ask them questions. You can demand to see results broken down by racial groups, by ethnic groups, etc. Yeah.
Ronke, thank you so much for sharing your perspective and insight. Thanks again for coming on the show.
Thank you so much, Dr. Foy. So good to meet you.